Mr. Speaker, I rise today to speak on behalf of Americans everywhere who are hurting because of Obamacare. They are calling out for relief from this disastrous law, and Republicans are here today to begin delivering on our promise to provide relief. Now, we'll hear plenty of claims from the other side of the aisle during this debate, but let's be clear. Obamacare has failed, and it's only going to get worse. Patients have seen skyrocketing premiums and deductibles, lost access to their doctors they preferred, had fewer coverage options, while others have had their plans canceled outright. It is no wonder so many people have rejected this law. In 2015, roughly 8 million Americans paid the Obamacare penalty, and more than 12 million Americans claimed an exemption from the penalty. That's 20 million Americans. What does that say about this law, that 20 million Americans want nothing to do with it, many preferring to pay a penalty rather than to be subjected to its higher costs and fewer choices? And if you ask me, it's strong evidence that the American people are tired of paying more and getting less. Of course, the destruction of the Obamacare extends beyond discouraging individuals to purchase coverage. It has been a direct attack on those who had insurance already. In my home state of Tennessee, 28,000 people lost coverage on a single day when the Cover Tennessee program lapsed after the Obama administration decreed that it ran afoul of the federal government's top-down requirements. Now, premiums in our state are rising by an average of 63%, and 3/4 of our counties only have one coverage option to choose from on the Obamacare exchange. In 5 other states around the country, Alabama, Alaska, Oklahoma, South Carolina, and Wyoming, patients only have one insurer in the marketplace to choose from. That makes it pretty difficult for someone to find a plan that meets their unique needs or that of their family. President Obama promised that this law would lower premiums by $2,500 per year for the average family. The exact opposite has happened. Average family premiums have gone up by $4,300, and deductibles have gone up by 60%. This is hitting hard-working Americans, many of whom are already struggling to make ends meet. Folks in Tennessee and all across the country are spending more and more money on their health insurance because of Obamacare when they'd rather be saving for a new house or for their children's college. The last thing working men and women need right now is a federal government making their life harder with more expensive health insurance by continuing to support this failed law. That's why we're here today. The Senate successfully passed this resolution yesterday, and now it's time for the House to deliver on our promise by kickstarting the reconciliation process so that we can repeal Obamacare and provide relief for the folks that are hurting because of this law. And while our friends on the other side of the aisle always claim that Republicans have no ideas or no plans to replace Obamacare, that simply isn't true, and they know it. I have with me here today a few examples, including the Better Way 37-page proposal that will provide access to care for all Americans and increase choice and competition. And I would like to also reference that Pete Sessions has a health care bill that he has filed. The RSC with Phil Rowe has a replacement bill that has been filed. Paul Ryan filed a bill right after the passage of Obamacare. And we also have Tom Price's replacement bill that is here. All of these documents are here and available for people to look at and also find them online, as well as the Better Way that we have put out from our conference. I urge my colleagues to vote yes on this resolution to begin the process of repealing Obamacare and paving the way for a patient-centered reform. With that, Mr. Speaker, I reserve the balance of my time.